You took a pill this morning, maybe two, maybe three. It took 10 seconds. You have done it the same way every single morning since your doctor handed you that bottle. And if you are over 60 and one of those pills is Atorvastatin, Eliquis, or Aspirin, there's a very real chance something is happening inside your body that nobody properly explained to you on the day you were handed that prescription. His name was Walter, 74 years old, retired electrician from Ohio, the kind of man who never missed a Sunday breakfast with his grandkids. 3 months after a minor heart procedure, his doctor put him on Atorvastatin and Eliquis together. His daughter Carol called me on a Friday night, her voice shaking. "Doctor, his gums will not stop bleeding." He thought he was dying. Nobody had ever told Walter what Eliquis does to a body that bumps its head, bites its cheek, or just brushes too hard. He sat in his bathroom for 20 minutes that night, convinced something inside him had broken. It hadn't. The gap was in what he'd been told, not in his body. I am a cardiologist. With over 32 years of clinical practice, what I am about to share with you are the 12 most important things every senior on these 3 medications needs to understand. Your doctor isn't hiding anything from you. A standard appointment just gives a physician 12 minutes to explain something that genuinely deserves much longer. Before we go further, drop your age in the comments right now and tell me this. Have you noticed anything since starting one of these medications that you quietly wrote off as nothing? I want to know, because what you write is going to matter to someone reading it who thought they were completely alone. If honest, clear guidance is what you have been looking for. Subscribe right now. I publish every week for seniors who want real answers about what is happening inside their body. Most seniors remember the same experience. A consultation that lasted a few minutes, a few words across a desk, your cholesterol is high, your risk of clotting is high, here is a prescription, take it once a day, come back in a few months. No explanation of what changes inside your liver, your blood, your vessels. No discussion of how a body at 74 handles these drugs differently than a body at 45. Just an instruction that sounds final. And most people walk away believing something incomplete, that the pill alone is protecting them. The truth is more precise than that. There are 12 things I want to walk you through. The 12th is the most important. Stay with me all the way to the end. 1. What these 3 medications actually are, and why they are not the same. Atorvastatin, Eliquis, and Aspirin are often grouped together as heart medications, but they work through 3 completely different systems, and that's exactly why the warning signs for each one look nothing alike. Atorvastatin is a statin. It lowers the cholesterol your liver produces, slowing the buildup of plaque inside your artery walls. Eliquis is an anticoagulant, a blood thinner. It interferes with the clotting factors your liver makes, so blood moves through your vessels without forming dangerous clots. Aspirin is an antiplatelet. It stops the small blood cells called platelets from clumping together at the start of clot formation. Think of it this way. Atorvastatin is working on the walls of the pipes themselves, trying to keep buildup from forming. Eliquis is working on the thick proteins in the water that let it clot into a solid mass. Aspirin is working on the tiny particles that try to stick to each other first. 3 different jobs, 3 different sites in your body, 3 different things that can go wrong. A senior who confuses these often makes the mistake of treating every symptom as if it came from the same source. A bruise gets blamed on the statin. A muscle ache gets blamed on the blood thinner. Neither of those is right, and that confusion is exactly how warning signs get missed. If you don't know which drug is doing what, you can't correctly read what your body is telling you. 2. The Atorvastatin muscle ache nobody takes seriously enough. Atorvastatin works inside your liver cells to block an enzyme involved in cholesterol production. In a meaningful number of patients, especially seniors, this also affects muscle tissue. The result is aching, heaviness, or weakness, often in the thighs or calves, often dismissed as just getting older or overdoing it in the garden. Most of the time, this is mild and manageable. But there is a rare and serious version called rhabdomyolysis, where muscle tissue breaks down and releases a protein that can damage your kidneys. The warning signs are severe muscle pain, dark or cola-colored urine, and unusual fatigue. Margaret, 70, spent 2 years blaming her sore legs on arthritis. She had been seeing the same rheumatologist, getting the same scans, hearing the same answer, wear and tear, nothing more to do. Nobody had asked when the soreness started relative to her atorvastatin. When we finally lined up the timeline, it lined up almost exactly. Her dose was adjusted, and within 6 weeks, the soreness most of us would have called normal aging was gone. Mild aches, mention it at your next visit. Dark urine or severe pain, call your doctor the same day. 3. Why your liver is quietly part of this conversation. Because atorvastatin is processed through your liver, doctors check liver enzymes periodically after starting it. Most seniors never ask why that blood draw is happening. It is not random. It is your doctor making sure the medication is being processed correctly and not stressing the liver. Grapefruit and grapefruit juice are a real interaction with that same liver pathway, not a myth seniors made up, and they can let the drug build up to higher than intended levels in your blood. This is not about avoiding fruit out of fear. Most seniors can have an occasional glass of orange juice or eat most other citrus without any issue. Grapefruit specifically contains compounds that block the enzyme your liver uses to break the medication down, so the dose you took stays active in your system longer and stronger than intended. If you enjoy grapefruit, ask your doctor whether it is safe with your specific dose, and don't assume the answer is the same for every statin or every senior. 4. The Eliquis bruise that means nothing and the bleeding that means everything. Walter's story starts here. On a blood thinner, small bruises appear more easily and take longer to fade. This is expected and on its own, not an emergency. What is an emergency is bleeding that will not stop after 10 to 15 minutes of firm pressure, blood in your urine or stool, vomit that looks like coffee grounds, a headache unlike any you have had before, or any fall that involves hitting your head. There is a middle category too, the symptoms that are not emergencies but are not nothing either. Bruises that show up without any memory of bumping into anything, nosebleeds that take longer than usual to stop, gums that bleed more than they used to during a normal brushing. These deserve a phone call to your doctor, not a trip to the emergency room, and not silence either. Eliquis is doing exactly what it was designed to do. The danger isn't the medication working. It's not knowing which symptoms are routine and which ones need immediate care. 5. Why missing a dose of Eliquis is not like missing a vitamin. Eliquis works on a tight schedule designed to keep your blood at a steady protective level. Skip a dose and that protection has gaps. Double up to make up for it, and you risk a level that is too thin, raising your bleeding risk. The rule is simple and worth writing down. If you remember within a few hours, take it. If it is nearly time for your next dose, skip the missed one and continue as normal. Never take 2 doses at once to catch up. A pill organizer with the days of the week marked clearly solves most of this before it becomes a problem. So does setting a phone alarm at the same time every day. Since Eliquis is most often taken twice daily, and the 12-hour gap matters more than most seniors realize. If you are unsure whether you took today's dose, look at the organizer before you guess. Guessing in either direction, assuming you took it when you didn't, or taking a second one because you're not sure, carries real risk either way. 6. The conversation every doctor's office and dentist must have before you sit in the chair. Eleanor, 78, scheduled a routine tooth extraction and never mentioned her Eliquis because, in her words, it did not feel relevant to her teeth. The bleeding during the procedure was significant enough that her dentist had to stop and call her cardiologist. What Eleanor didn't know is that some procedures need Eliquis paused for a specific window beforehand, while others, including most basic dental cleanings, don't require any change at all. The decision depends on the procedure, your specific bleeding risk, and your clotting risk if the medication is paused even briefly. That decision belongs to your doctor, not to you, and not to the office scheduling your appointment either. Any procedure, dental work, surgery, even some skin biopsies, requires your doctor to decide whether Eliquis should be paused beforehand and for how long. Never stop it on your own, and never assume a provider already knows. Say it out loud every single time. I am on Eliquis. 7. The aspirin myth that costs seniors the most. Because aspirin sits on a pharmacy shelf without a prescription, most seniors do not think of it as a real medication. It is. Daily aspirin thins your blood and, like Eliquis, increases bleeding risk, particularly in the stomach lining. Long-term daily aspirin use in seniors is linked to a higher rate of gastrointestinal bleeding, and current guidance has shifted significantly. For decades, doctors routinely recommended daily low-dose aspirin to almost any senior worried about heart disease, even those who had never had a heart attack or stroke. That blanket recommendation has changed. Many seniors who started daily aspirin years ago for general prevention are now being told to stop, because for many people the bleeding risk outweighs the benefit, especially past a certain age. Frank, 73, had been taking a daily aspirin since his 40s because a doctor he no longer even sees had once suggested it. Nobody had revisited that decision in over 20 years. When we did, the math had changed completely, his risk profile had changed, the medical guidance had changed, and the daily habit no longer made sense for him. If you started aspirin on your own, or years ago, and have not discussed it with your doctor recently, that conversation is overdue. 8. What happens when aspirin and Eliquis are taken together? Some seniors are prescribed both. When that is medically necessary, it is intentional, and the combined bleeding risk is being actively monitored. The danger is when someone is already on Eliquis and adds daily aspirin on their own for a headache habit or an old prevention routine without telling their doctor. Two different blood-thinning mechanisms stacked without supervision is one of the most preventable causes of serious bleeding events in seniors. Never add aspirin to an existing blood thinner without asking first. 9. The hidden link between statins and blood sugar. Atorvastatin has a modest but real effect on raising blood sugar in some patients, enough to matter for seniors who are pre-diabetic or already managing diabetes. This does not mean the medication is unsafe. The cardiovascular protection it provides almost always outweighs this effect, and for the vast majority of patients, the heart benefit is the bigger priority by far. It does mean your blood sugar should be checked periodically while on it, especially if you have a family history of diabetes or were already borderline before starting the medication. Bernard, 71, noticed increased thirst and fatigue 8 months into Atorvastatin and assumed it was unrelated, chalking it up to the heat that summer and getting older in general. It was not unrelated. It was worth a simple blood test that nobody had scheduled. Once it was caught, managing it was straightforward, a small adjustment to diet and a follow-up test in 3 months. The lesson wasn't that the statin was wrong for him. The lesson was that nobody had connected a new symptom to a medication he'd been on for less than a year. 10. The medicine cabinet item that turns a thinner into a danger. Ibuprofen and naproxen, common over-the-counter pain relievers, also thin the blood and irritate the stomach lining. Combined with Eliquis or aspirin, the bleeding risk compounds quickly, particularly in the digestive tract. This interaction rarely comes up at appointments because ibuprofen does not feel like a real medicine. It came from a shelf, so it never gets mentioned. Ask your pharmacist directly. Is it safe for me to use ibuprofen given everything I am taking? That question is free, and it closes a gap nobody else will close for you. 11. What illness does to a blood thinner? Vomiting, diarrhea, and dehydration change how your kidneys clear Eliquis from your body. A body that is depleted handles a steady dose differently than a hydrated, stable body. Gerald, 76, had a stomach virus and kept taking his Eliquis exactly on schedule because he had not missed a dose in over a year. His doctor later explained that significant illness with fluid loss is exactly the kind of situation that warrants a call before continuing as normal, not after. It isn't that the medication suddenly becomes dangerous during illness. It's that everything around it, your kidney function, your fluid levels, your overall stability has shifted, and the dose that was right yesterday may not be right today. The same caution applies to any senior who becomes seriously ill for any reason, not just stomach viruses, including infections, fevers that won't break, or anything that keeps you from eating and drinking normally for more than a day. Write this down and put it somewhere you will see it when you are unwell. If I cannot keep fluids down, I call my doctor before assuming my dose stays the same. 12. The truth almost never said on the day the prescription is written. None of these 3 medications erases the disease producing your risk. Atorvastatin slows new plaque formation, but it does not reverse decades of buildup that already exists. Eliquis prevents new clots, but it does not repair the heart rhythm or vessel damage that made clotting a risk in the first place. Aspirin reduces platelet clumping, but it does not address the underlying inflammation in your arteries. All 3 manage risk. None of them erase the condition creating that risk. This is why follow-up appointments matter more than the first prescription. This is why diet, movement, and sleep are never optional extras. The seniors who do best on these medications are not the ones taking the most pills. They are the ones who understand exactly what each pill is doing and what it is not doing, and they work with both truths at the same time. The practical framework. If you take Atorvastatin, watch for unusual muscle pain or dark urine. Ask about liver checks. Be mindful with grapefruit. If you take Eliquis, know the difference between a normal bruise and dangerous bleeding. Never skip then double a dose. Tell every provider before every procedure. If you take aspirin, treat it as a real medication, not a shelf item, and revisit whether you still need it daily. For all 3, never add ibuprofen or naproxen without asking your pharmacist. Call your doctor before continuing as normal through any illness with vomiting or diarrhea, and never stop any of these suddenly without speaking to your doctor first. Walter's gum stopped bleeding that night with simple pressure, exactly as instructed by phone. At his follow-up, we went through every one of these 12 points together. He told me, I spent 20 minutes in my bathroom thinking I was dying from something that had a name and a simple answer. I just needed someone to explain it. 3 months later, he brought a 1-page summary to his Sunday breakfast table and handed it to his son-in-law, who was on the exact same combination and had never been told any of it. His son-in-law went to his own doctor with a list of questions he hadn't known to ask and walked out with answers he should have had years earlier. That is what this channel exists to do. After 32 years in cardiology, the one thing I know with absolute certainty is this. The seniors who manage their heart health best are not the ones on the most medications. They are the ones who understand what is actually happening inside their body and use that understanding to make better decisions every single day. Information does not replace medication. It makes the medication work the way it was meant to. Now I want to ask you one question. Which of these 3 medications are you currently taking? Atorvastatin, Eliquis, or aspirin? Just type the name in the comments. That single answer tells me what matters most to you and what I break down next. And before your next dose, carry this question with you. Do I actually understand what my medication is doing inside my body right now and what it is not doing? If the answer is not fully yes, that is not your fault. That is the gap this channel exists to close. Subscribe so you never miss the guidance your health deserves before the emergency you never saw coming. And I will see you in the next one.